Do you find yourself constantly wiping away sweat, not just in a hot, outdoor, humid environment, but even in an indoor, air-conditioned environment? Hi, I'm Dr. Angeline Yong, board-certified dermatologist, and today we're going to talk about hyperhidrosis, a rather irritating, pesky, sometimes embarrassing condition to treat that gives rise to increased sweating over your underarms, palms, and soles, to name a few areas. While the exact cause of hyperhidrosis is oftentimes unknown, or what we consider primary hyperhidrosis, there are certain factors that we can look into. For example, genetics. So sometimes primary hyperhidrosis does run in families. 2, it can be hormone changes as well. So sometimes this can happen due to hormone changes during puberty onset, pregnancy, and even during menopause. Thirdly, the nervous system. So overactive sweat glands can also be triggered by an overactive nervous system. Fourthly, sometimes certain medications can also induce hyperhidrosis as a side effect. Finally, certain underlying medical conditions may also be associated with excessive sweating, such as Parkinson's or even diabetes, to name a few. So once you've been diagnosed with primary hyperhidrosis, which means it's not associated with an underlying medical condition, drug, or even hyperthyroidism, for example, and this is just basically due to your underlying genetics, then these are some tips that can help you to manage this better. So 1, dress appropriately, wear lightweight, breathable fabric that can be easily adjusted. 2, avoid triggers. If you identify certain triggering environments, try to reduce exposure to them. Thirdly, reduce stress. For example, practice meditation or certain exercises like yoga to help to manage stress better. So finally, practice good hygiene as well. So frequent, regular showers with very gentle products can be useful to help to manage hyperhidrosis. So there you are. Other than lifestyle tips, we also have a range of options that your medical practitioner can recommend for you to deploy to better manage your primary hyperhidrosis. So again, going up the pyramid or working up the ladder, we start with over-the-counter or prescription-strength topical antiperspirants. So typically, these products may contain ingredients such as aluminum chloride hexahydrate that works by temporarily blocking your sweat ducts and reduce sweating. This is typically applied on dry, clean skin and can be applied more than once a day. Next up, other than topical antiperspirants, we have ionophoresis, which typically involves passing an electrical current through water and can be very suitable for certain areas like the hands and feet. And typically, the effect can last between 2 to 3 days. It can be done not just in the office, but can be deployed as a home-based device as well for convenience. Thirdly, we have botulinum toxin that's not just used to treat facial aesthetics, but can be used medically speaking for hyperhidrosis as well. So we can use it to treat axillary hyperhidrosis, palmoplantar hyperhidrosis, as well as facial hyperhidrosis. So there you have it. It actually works by blocking the signals to the sweat glands, reducing sweating, not just for hours or days, but up to a few months at a time. Next up, we also have oral medications such as glycopyrrolate, which can be used to treat hyperhidrosis. However, being oral, it is non-selective and hence it affects big areas of the body and can have certain other side effects such as blurring of vision and a dry mouth as well. Next up, we also have certain energy-based devices that are increasingly being used or popularized for treating hyperhidrosis. For example, microneedle radiofrequency is also being used or deployed to treat hyperhidrosis in the area by reducing the sweat duct activity. Finally, we have surgical options such as endoscopic thoracic sympathectomy that can be used for more severe refractory cases. However, this also comes with a risk of compensatory hyperhidrosis in other locations on the body. So there you have it. This video is not meant to be exhaustive, but to be informative of the various subgroups of treatments that we have available today. So the bigger range or a broader toolkit that your dermatologist has, the better they are equipped to tailor to your individual needs. So taking into account not just gender, sometimes preferences in lifestyle, as well as certain individual beliefs in what they prefer, natural enhancement versus a bit more invasive treatments or in combination, but also taking into account individual medical skin conditions, for example, like sensitive skin types like rosacea and eczema have to be also taken into account for, and hence going to a right practitioner that is not just board certified and trained in the biology of the skin and understands the anatomy and structure of age-related processes, but also somebody that has a wide repertoire is important. If you like this video, don't forget to like and subscribe to our channel for more interesting dermatological content.